Hi, my name is Alejandra and I'm a pre-med undergraduate student that hopes to become an oncologist in the near future. I'm here to talk to you about a recent study that could potentially change the way pancreatic cancer is diagnosed. This type of cancer is currently the fourth most common cause of cancer death in the United States, and it is expected to become the second most common cause by the year 2030. Pancreatic cancer, just like any other cancer, has different stages at which it can be diagnosed. Every stage describes the size of the tumor and if it has spread to other places in the body. The methods currently used to detect this disease are not always the best alternative to detect the stage at which the cancer is found, and it isn't until a patient undergoes surgery that doctors are able to observe and determine the severity of the situation. It is really important to be able to properly diagnose patients before attempting surgery, because after the procedure, if the diagnosis changes, then the patient has to wait to be fully recovered to try other treatment alternatives. In order to improve the way pancreatic cancer is detected, researchers have looked at specific biomarkers. We can think about biomarkers like the warning lights in a car. When they come on, we know that something is wrong with the car and we should take it in for a checkup. The biomarkers that are being studied for pancreatic cancer are known as CTCs, or circulating tumor cells, found in the blood. The researchers put on a study to determine if the amount of CTCs present in the blood are increased with the stage of the cancer. The study had a total group of 100 patients. 72 were diagnosed with pancreatic cancer and 28 had no pancreatic cancer at all. This was done to observe if CTC were only present in the patients going through cancer. The results showed that only pancreatic cancer patients had CTC counts in their blood. The patients without the disease had zero presence of the biomarker. However, these results showed that the amount of CTC varied in all the patients that were already diagnosed with the pancreatic cancer. For this reason, it was decided to see if the biomarker count was different at different stages. From the 72 patients, 3 were on stage 1, which is a small tumor that is staying in one place. 28 patients in stage 2, the size of the tumor has increased but it still remains in the same place. 14 in stage 3, the tumor is bigger and is starting to spread to other parts in the body. And stage 4, which is when the tumor has already spread to other body tissues. This is also referred or known as metastasis. With the result, it was found that indeed the count of biomarkers was different for every cancer stage. As the stage increased, so did the count of CTC biomarkers found in the blood. This study showed that biomarkers could be a good resource in detecting the presence of pancreatic cancer. It is an important tool because it will be a less invasive procedure that will act faster and provide patients with more time to consider different treatment alternatives to target the disease. Thank you.